If you turn to 65 and looking at Medicare options, one of the questions you need to ask yourself is, can I afford to get sick on Medicare? Or more importantly, can I afford to get well on Medicare? Well, we're going to talk about that today. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. All right, I got some news for you. All this good health that you probably have enjoyed up till this time, things are going to change once you turn 65. It's kind of like having a car that, you've kept it for a number of years. Maybe it's getting close to 100,000 miles or so. And things are starting to wear out, tires and brakes and transmissions maybe and a whole bunch of other stuff. Well, your body is pretty much the same way. This old body isn't designed to go on forever. Things wear out over time. You may need a joint replaced. You may need to have cataract surgery. Could afford to have a heart valve replaced or something along those lines. And, gosh, what if you get the big C and you have to go through chemotherapy, radiation therapy? Can you afford to pay 20% of the cost of this stuff in order to get well again? I mean, we could be talking about several $1,000s out of pocket, depending on the Medicare plan that you have. But you could be talking about several $1,000s that you have to come out of pocket if you want to keep on breathing. Yeah, okay. Well, you've basically got two choices. You can go with one of these Advantage plans, PPO plans. Some people also call them Medicare alternative plans. You can go with one of those. They sure are sexy looking. I mean, there's no premium for most of them. They've got extra this and extra that and $10 copays on a lot of things. But I got news for you. If you get sick on one of these things, you could very well have to come out of pocket several $1,000s, maybe upwards of $5,000 or $6,000 or $8,000. Can you really afford to do that? Well, the other alternative is original Medicare and a supplement plan. That kind of combination will allow you unfettered access to any doctor or hospital in the country that takes Medicare. And that's just about all of them. You don't have to get permission to go see somebody. And the good news is, if you do get sick, or injured, and you've got several $1,000s of bills out of pocket, that you're getting bills left and right from different Medicare providers. Good news is you're out of pocket for health care is generally going to be less than $300 a year. Now think about that. Which would you rather do? Have several $1,000s out of pocket or maybe just a few hundred? That's up to you. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.